Hello everyone, and welcome to another parts of reproductive female hormones, speaking about the sex hormone. The third part, we already spoke about the estrogen, progesterone, progestin, and the third part we are going to speak about selective estrogen receptor modulators. Okay, for the regarding the selective estrogen receptor modulator (SERM), this group of medication displays effect of agonist or antagonist, depends on the receptor, depends on the tissue type. We have less of medication here. We have tamoxifen, raloxifene, bazodoxifene, clomiphene, osmemifene. So I'm going to speak about this group of medication. You can see the suffix "fene", tamoxifen, raloxifene, bazodoxifene, clomiphene, osmemifene. Okay, starting with the first medication, as you can see it here, we have raloxifene, the brand name Avesta. Raloxifene considered like partial estrogen agonist, antagonist, so has both of them, agonist, antagonist. Practice not all target tissue are the same. For example, they found the raloxifene stimulate estrogen receptor in the bone. So consider raloxifene consider agonist on the for the estrogen on the bone. So agonist on the bone, this is great. The Vista, they found Vista lower total cholesterol LDL. That's great. Also, this is a benefit. Number one, agonist on the bone. That means this medication decrease bone resorption, increase bone density, and decrease risk of fractures, vertebral fractures. This is a benefit. Another benefit from raloxifene, lower LDL and cholesterol. This is another benefit. The raloxifene does not stimulate estrogen receptor in the endometrium or breast tissues. So there is no risk of cancer here. Please remember that raloxifene, number one, agonist on the bone and used for treatment and prevention of osteoporosis. Positive effect on lowering cholesterol and LDL, does not stimulate the estrogen receptor in the endometrial breast. There is no risk of cancer. The only drawback, the only negative things related to the raloxifene may increase risk of thromboembolic deep vein thrombosis as a black box warning from the deep vein thrombosis. If you click on the link here, and they will take you to the this one related to the Vista raloxifene, you can see the black box warning here. Okay, increased risk of deep vein thrombosis, increased risk of death due to the stroke. So all these related, deep vein thrombosis, increased risk of stroke. Okay, this is the main drawback, black box warning regarding the raloxifene. And you can see the raloxifene used for the prevention and treatment of osteoporosis in postmenopausal women, and reduce the risk of breast cancer, reduce the risk of breast cancer in postmenopausal women. So we have several approaches for raloxifene. Okay, so what happened there if you have, for example, a patient suffer from osteoporosis plus risk factor of breast cancer? This is a medication, because this medication reduce risk cancer, reduce risk of breast cancer, and used to treat osteoporosis. So raloxifene, we use it for both. If you go back, I'm not sure if it's still open. Okay, we have it there. So you can see it here if the patients are from the recent changes here. You can see it, treatment and prevention of osteoporosis, postmenopausal woman, and reduced risk of breast cancer. So if you have two cases together, that will be great. We can use it for if the patients are from high risk of breast cancer, and at the same time she has maybe the current disease of osteoporosis. Raloxifene, Vesta. Tamoxifen was the first selective estrogen modulator. Tamoxifen was the first selective, and tamoxifen practice antagonist effect on the breast, and tamoxifen used for the treatment of breast cancer. So the medication now used for treatment of breast cancer called tamoxifen. This is good, but they found later on tamoxifen practice agonist effect on the endometrial receptor, and this increased risk of endometrial cancer. So tamoxifen used to treat breast cancer, but carry the risk of endometrial cancer. We need to remember that. So you see that tamoxifen antagonizes the effect of estrogen on the breast and use it for the breast cancer. Tamoxifen may cause uterus or endometrial cancer because practice agonists on the endometrium. Okay, osfina or osmifene estrogen agonist, antagonist, osmifene both agonist, antagonist. This medication used for patients suffer from dyspareunia, which means painful sexual intercourse related to the menopause or menopause. So you can see it here. The osmifene is like a partial, it's like agonist, antagonist, mainly used for dyspareunia, and this related to the painful sexual intercourse related to the menopausal symptoms. These medications use it for the moderate to severe vaginal dryness. So this medication could be used for this indication here for the treatment of vaginal atrophy due to the menopause. If I click on the website, so you can see the osmifene tablet, osfina menopause should be liberating, not irritating. So please remember this medication, we use it for the vaginal dryness, vaginal atrophy, dyspareunia. So which of these medications belong to the SERM and used for dyspareunia, vaginal dryness, and vaginal atrophy? We have osfina or osmifene. Okay. What potential side effects should be this question here, multiple choice question. What potential side effect should be monitored closely when using raloxifene in 70-year-old women with the osteoporosis? So the case here, the woman suffer from osteoporosis, 70-year-old. Okay, potential side effect. We ask about the potential side effect of using raloxifene. So what is the potential side effect of using raloxifene here? So we ask here about the side effect related to the raloxifene. So the medication here will be raloxifene, and we use it for osteoporosis. Any side effect could be breast cancer, endometrial cancer, venous thrombosis, or a hypercholesterolemia. So what do you think here? So raloxifene for treatment of osteoporosis, if you remember, the black box warning will be the venous thrombosis. Okay, another medication, we discussed the first one, if you remember, raloxifene, the second one tamoxifen, then we move to the osmifene for dyspareunia. Number 4, we have conjugated estrogen plus bazodoxifene, Diovi for menopausal symptoms. So we have two medication here. We have estrogen, conjugated estrogen, plus we have bazodoxifene considered SERM, okay, and the brand name Diovi. This combination of treatment here, they found this medication used for patients suffer from vasomotor symptoms and osteoporosis. This will be great. So two cases here. If the patient suffer from vasomotor symptoms, we use estrogen. If the patient suffer from osteoporosis, we use bazodoxifene. We have it in one tablet, conjugated estrogen. Bazodoxifene is labeled for treatment of moderate to severe vasomotor symptom associated with the menopause and prevention of menopausal osteoporosis. If you click on the information leaflet about the medication, okay, move to the indication here, treatment of moderate to severe vasomotor symptoms with menopausal, and the second one, prevention of postmenopausal osteoporosis. So we have two cases here, treat moderate to severe vasomotor symptoms and treatment of prevention of osteoporosis in postmenopausal women. Okay, So speaking about menopausal symptoms, vasomotor menopausal symptoms, new medication. We discussed the UV here, which include conjugated estrogen, bazodoxifene. Then we move to Vioza, and we have the link website here for Vioza. Vioza is not hormone. This is the important thing. Vioza is work on the mediator called neurokinin receptor here, and this receptor considered like a neurokinin receptor antagonist, indicated for the treatment of moderate to severe vasomotor symptoms. So now we have several medication for vasomotor symptoms. Start from osmivine, moving to the Diovi, moving to the Vioza. What is Vioza? It's a neurokinin 3 receptor antagonist. Okay, this flow chart here or this diagram show the effect of raloxifene, tamoxifen on the breast, uterus, bone, cardiovascular system. Is very important to notice that raloxifene, for example, here practice benefit effect for the bone, raloxifene, benefit effect of the bone, and for this reason we use raloxifene for treatment of osteoporosis. Raloxifene considered like agonist on the cardiovascular system, raloxifene antagonist on the uterus and on the breast. For example, if the patients are from osteoporosis plus risk of history of breast cancer, okay, and we can use raloxifene for treatment of osteoporosis and prevention of breast cancer. Regarding the tamoxifen considered like agonist on the bone, prevent of osteoporosis. Tamoxifen considered like antagonist for the breast, and we use it for the patients suffer from treatment of breast cancer. Tamoxifen, because tamoxifen antagonizes the receptor of estrogen receptor on the breast, but tamoxifen carry the risk of uterus cancer due to the activation of estrogen receptor on the endometrium. So the risk factors here, the risk factor for raloxifene, will be deep vein thrombosis or thromboembolic. This is the risk factors here. The risk factor for the tamoxifen, the main risk factors, endometrium cancer. So we have different approach here. Okay, how the estrogen work, as you can see here, we have the estrogen, and we have the receptor here. This is the estrogen receptor, ER, and we have the estrogen in the circulation. The estrogen enter the cells, and become available in the cytoplasm. The estrogen bind to the estrogen receptor, and this complex here affect the DNA strand and RNA polymer strand, and responsible for gene expression. This is maybe the effect. So you can see here the estrogen bind to the receptor and practice positive effect on the RNA DNA strand. Okay, moving to the antagonist now. We talk about SERM. Could be agonist, could be antagonist. If you speak about agonist, this is similar effect of estrogen. Similar effect of estrogen when you have it like agonists. For example, we talk about raloxifene. Raloxifene considered agonist, and you can see here raloxifene bind to the receptor and practice effect on the DNA and RNA strand or polymerase. If the SRA practice antagonist effect, so you can see here the SERM. For example, if you speak about tamoxifen, tamoxifen antagonize the estrogen receptor on the breast. So this one apply for the tamoxifen. So the situation here, you can see the antagonist tamoxifen. This is the tamoxifen, represent the tamoxifen. Tamoxifen enter and bind to the estrogen receptor. And what we can see here, tamoxifen prevent estrogen from binding to the receptor. So you can see here tamoxifen replace or displace the estrogen from the receptor, inhibit, affect the estrogen on the the receptor, and there's no gene expression, no gene transcription here. Okay, so example here, tamoxifen. The example here will be raloxifene. Okay, next medication related to the SERM. We have clomiphene. Clomiphene considered like partial estrogen agonist, inhibit estradiol's negative feedback on the hypothalamus and pituitary. So clomiphene inhibit the negative feedback. So when you inhibit the negative feedback, the result will be stimulatory effect. Therefore, we use clomiphene to treat infertility. So increased secretion of, this will lead to the increased secretion of GnRH, increased secretion of FSH plus LH. Okay, clomiphene considered like partial agonist for estrogen. This will lead to the inhibit the negative feedback of hypothalamus and pituitary. Clomiphene increased secretion of GnRH and FSH-LH gonadotropin, leading to the stimulation of ovulation, and this medication used successfully to treat infertility. Okay, this diagram here represents the mechanism of action of clomiphene. As you can see here, clomiphene inhibit the negative feedback. So we know that estradiol practice negative feedback for the hypothalamus and anterior pituitary, and our medication clomiphene inhibit the negative feedback of the estrogen, inhibit the negative feedback of progesterone. So the progesterone also practice negative feedback on the both hypothalamus and pituitary gland. The clomiphene inhibit the negative feedback of estrogen on the hypothalamus and GnRH. Next medication we have mifepristone. Mifepristone considered like progesterone antagonist. Mifepristone, progesterone antagonist. So we know that from the previous slide, we need progesterone to maintain pregnancy. We need progesterone to prevent bleeding. We need progesterone to maintain pregnancy and prepare the endomaterial for implantation. What happens if you antagonize the progesterone effect? Progesterone in this case may cause, number one, uterine contraction. Number one. Number two, progesterone may use for termination of pregnancy due to the interference with the progesterone that need to maintain pregnancy. So we need progesterone to maintain pregnancy. If you oppose the progesterone effect, the result will be termination of pregnancy, abortion. So we can use a mifepristone combined with a prostaglandin such as misoprostol, and which administered buccally and to induce uterine contraction. So what we have here, we have mifepristone with the misoprostol, prostaglandin with the progesterone antagonist. So we have prostaglandin. Prostaglandin. Okay, and we have misoprostol. Then we have progesterone antagonist. The medication name mifepristone. We used these two medications together to induce abortion. Okay. Okay, next medication belong to the sex hormone. We have danazol. Danazol considered like derivative of 17-alpha ethinyl testosterone. Danazol inhibits cytochrome B450. So danazol inhibits cytochrome B450. This enzyme responsible for synthesis of steroid synthesis. Danazol inhibit the mid-cycle surge of LH and FSH, and inhibit gonadal function, inhibit the testis, and inhibit the ovary function. And the main use of danazol will be treatment of endometriosis. Also, danazol has been used for the fibrocytic disease of the breast. So we have two main cases. The major use for treatment of endometriosis another case to treat the fibrocystic disease of the breast. So we have two cases. How the danazole work? Danazole inhibit several cytochrome in the B450 enzyme and prevent synthesis of gonadal enzyme. And we have it on the slide, and maybe I will share it with you just 1 minute to show you the mechanism of action. Again, this slide, what we need, you can see here the danazole inhibit the cytochrome B450. This will lead to the inhibit formation. The end result will be inhibit formation of gonads, inhibit formation all these gonads. And they said this medication danazole, we use it for endometriosis. Okay, we have danazole. Moving to the, if you click on danazole here for the information leaflet about danazole, and this is the information leaflet for the information prescribing danazole, and we have donocrine or donocrine. So if you scroll down how the danazole work, okay, so you can see here suppression is probably the combination of the breast hypothalamus pituitary response, pharmacokinetic. Then we go to the indication. So you can see the main indication for danazole endometriosis, and the second case will be fibrocystic breast disease. So we have two main cases, and we have another case called hereditary angioedema, could be treated with danazole. So we have three main indication here. Number one, the most common case will be endometriosis. Secondly, will be fibrocystic breast disease. Okay, the next medication, next group of medication belong to the formation of estrogen. We have aromatase inhibitors. We have two medication there for aromatase inhibitor. We have anastrozole, letrozole. These two medication considered like a competitive inhibitor of aromatase, inhibit the enzyme, and this enzyme responsible for formation of progestin or formation of estrogen. So anastrozole, letrozole inhibit aromatase enzyme, and this enzyme required for formation of estrogen. We use anastrozole, letrozole for treatment of breast cancer when the patient suffer from breast cancer that resists to the tamoxifen. So if you click on this one here for anastrozole, and maybe I will show you how the medication work when you finish. Okay, anastrozole, you can see here anastrozole and the brand name Arimidex. This medication used for patients suffer from for women with a hormone receptor positive early breast cancer. First line therapy for postmenopausal women with a hormone receptor positive or hormone receptor unknown locally breast cancer. So mainly for the breast cancer, anastrozole. Okay. So please remember anastrozole considered like aromatase inhibitor. Then we have fulvestrant. The anastrozole, letrozole inhibit the enzyme called aromatase. That's it. Then we move to the fulvestrant. Fulvestrant is the pure estrogen receptor antagonist. Fulvestrant, the pure estrogen receptor antagonist, more effective than partial agonist. Fulvestrant used for breast cancer. When tamoxifen is not maybe when the situation resists the tamoxifen. Now we have the process how to approach patients from breast cancer. The first medication will be tamoxifen. This drug, this is the first medication, tamoxifen. We start with the tamoxifen. As the breast cancer resists, we can use anastrozole or letrozole. If the situation resists, we can use fulvestrant. So we have three type of receptor. We can use it. We use number one tamoxifen, number two anastrozole, letrozole, number three fulvestrant. Okay, next medication related to the sex hormone or reproductive female hormone, GnRH, analog gonadotropin releasing hormone. We have analog and antagonist. You can see here the continuous administration of GnRH agonists such as leuprolide. If you go back to the first lecture, Continuous administration lead to suppression or suppresses of gonadotropin secretion, and this will lead to the inhibit effect on the estrogen and progesterone. So that we ask ourselves what cases we need to inhibit the estrogen progesterone. They said, what about endometriosis? Yes. What about prostate cancer, uterine fibroids, and precocious puberty in children? And with some cases when you need like controlled ovarian hyperstimulation. Okay, so this is the situation when you use the GnRH like continuous administration, leuprolide. We have goserelin and hysterelin, if you remember, from GnRH analog. This medication inhibit production of estrogen and progesterone. So we have it like endometriosis, uterine fibroid, prostate cancer, and control ovarian hyperstimulation. If you click on the link here to review with the prescription leuprolide prescribing information, leuprolide. Okay, I will go to the indication here. This medication used for prostate cancer. Okay, prostate cancer. This medication used for endometriosis, precocious puberty in children, because inhibit estrogen progesterone. Someone may argue what happened with the estrogen progesterone here with the children, could be male or female. This one, because this one inhibit FSH and LH, and FSH LH available in male and female. So we can use it for both male or female early, like precocious puberty in children. Okay, this will conclude our lectures about reproductive female hormones. We cover the estrogen, we cover the progesterone, we cover the selective estrogen modulators. We cover the anti-progesterone or anti-progesterone. We cover the GnRH analog and agonist, antagonist. The last part of the female reproductive hormone or reproductive female hormones will be the oral contraceptive, will be covered in separate session, and we are going to speak about later on at the end of this lecture. Thank you so much for your listening, and have a great day, everyone.